welcome. Happy New Year, or if you're in Wales, Blwyddyn Newydd Dda is Happy New Year in Welsh. Hope everyone is very well. We're absolutely delighted that you come to join us in January, and this is the first of this calendar year. I know everyone's probably operating in financial years at the minute, but the first calendar year of our Clinical AI Special Interest Group, and we're just very excited about another year with all of you. The plan for today is to have a bit of a run through as a bit of a social networking, because we don't really get the chance to do that on our weekly chats where we have external speakers or yourselves that are speaking. So we'd like to do that to enable everybody to have the chance to meet others, but also to capture your thoughts and ideas on what you're looking forward to over the next 12 months. And also if there are particular things that actually you'd like to do through the Clinical AI group, or where we can help it in that space as well too. But we'll come to that in a minute. To start with, I'm going to go around our co-chairs and ask them what they're looking forward to in this year for the Clinical AI group. I'll start with mine first while they have a minute to think. And this year, I'm really looking forward to seeing actually our collective successes. I think we had a really busy year last year, but what I'd like to do this year is think about how we capture some of that, about the impact that we're having, that's both through kind of shared learning, but actually some of the fantastic work that's happening in the super groups as well too. So yeah, I'm really looking forward to the momentum that's building in this space, and the more that you're putting in, the more that everybody's collectively getting out, which is just wonderful. So that's from me. I'm going to go to Nick.
Thanks so much, Alicia. Yeah, I mean, 2025 feels like it's going to be a big year for lots of different things, but certainly for the Clinical AI Interest Group. So the kind of overarching aims of the Clinical AI Interest Group, for anyone who's new to it, is that firstly sharing, so the kind of monthly webinars and events to share developments within the field. Two is to be a pool of resources to feed into activities within the Turing, and that's really our super interest groups. And thirdly is educating, and I'm going to pick on educating as one of the things that I'm really excited about. We've run a summer school for the last 2 years now, developed a practical for people to run through, which is a computer vision program using Python code, and really educating and developing AI naive clinicians is an area that I'm very passionate about, and really excited about running that later this year. Just one other thing I'm excited about in AI, Clinical AI for 2025, is that this might be the year when a large language model passes through regulation, and that would be a really exciting development if it did happen.
That would, we could have a really good discussion on that. Lovely, thanks, Nick. Joe.
Yeah, thanks, Alicia, and Happy New Year, everyone. So I'm going to take the opportunity to mention two things I'm excited about this year. First is a personal thing, and second is something about the whole group. So let's start with the personal thing, that I'm nearly finished my PhD. In fact, I'm due to submit in the next month, or maybe two, depending on how quickly I get written up. So that's quite exciting. It's kind of loosely aligned to artificial intelligence. I'm actually working on predictive models, kind of lower tech modeling used in healthcare, but still been a lot of my life the last few years. So that's me. And then what I'm interested about for the wider group is really expanding our seminar series. So for those of you that have been joining us over the last 18 months, 2 years, you'll know that we have monthly speakers. And many of those speakers are really renowned international experts in their field. And I'm just really looking forward to working with you, the community, and to bring in some phenomenal speakers and to pitch our meetings so that we're starting to better target some of the things you're really interested in. So yeah, really looking forward to some interesting talks and interesting speakers moving forward.
Lovely, thanks, Joe. And Emma.
Thank you, and Happy New Year, everybody. I can't even speak. I'm going to do the same as Joe and just have a personal one, which is a bit of an ask actually from me. and then a sort of more broader one for the group. So my ask is that I'm about to start a new project next month called Advancing Biomedical Data Science Careers, because I'm very much into capacity building. And it's an MRC funded project. And basically our task is to document really great interdisciplinary health data science. So I'm really looking for examples from the clinical AI space, clinical data science space, of people to do case studies with me. So at different levels, so organizational level, at team level, so talking about how you've got a great interdisciplinary team, how you made that actually happen, and also individuals that work in this space and how they've actually been able to navigate this space and have careers in this space. So please do contact me. I'll put I think probably everyone's got my email address, but I'll put it again in the chat in a minute. Do approach me because I'm open to doing loads of different case studies in the next couple of years around this project. And I think it's really exciting that the MRC are actually they funded 5 projects and they're all quite similar about really trying to leverage recognition in this space and actually drive forward these types of careers where we're really focusing on diverse types of data science roles. So yeah, please do contact me about that. And then the second thing, kind of related, is all about capacity building. But I was reading the government AI action plan yesterday, which I'm sure other people were reading.
To-do list.
Very
Yes.
exciting.
Your insights,
And yeah, so yeah, there's loads in there about capacity building, building talent, all this kind of stuff. So I'm really excited that I think there's going to be money floating around for this at some point. So can we as a group kind of leverage some government money to help us with our kind of upskilling that Nick was talking about in different ways? So I think that's something that we need to really sort of pull on this year, whether we can find government contacts. If you're here at the moment and you're a government contact, we want to speak to you. So I think that's quite an exciting step forward, this AI action plan.
Fantastic. Thanks, Emma. Oh, I'm glad. Oh, Nick.
Just one other quick one. I just had to attend. I'm sorry, I had to attend to a puppy who was going a little bit wild in the next door room. Just I don't know whether Joe said this whilst I was out, but about the super groups, and about it's just been amazing to see the way that these groups are, coming together and really thriving and growing. In October we heard about the amazing work and research that's going on in the anaesthetics and ITU group. Then the public health takeover after that in November. The women's health group hosting a meeting later on this month, and then having an in-person meeting in Cambridge in this summer as well. It's just so exciting to see. And the MSK AI Super Interest Group is also launching on Wednesday. So much activity, so much going on. Really exciting.
Brilliant. Thanks, Nick. And actually, the public health, we're starting it as a bit of a debate series. So the next one's going to be in February or March. We're just sorting out the speakers' dates. But with will AI help in terms of climate change and the impact on health, or will it cause more of a problem with the energy costs and the impact of AI itself on the environment? So yeah, the kind of 2 sides to one question. Fantastic. So that's just a flavour of some of the things in a couple of minutes that are in our heads. But there will be many more that come through whenever we get on the Canva board and have a bit of a discussion. But before that, we wanted to introduce a couple of our members. So I'm going to hand over to Emma, who's going to bring them forwards. Emma.
I can't unmute. Hello again. I'm just gonna I haven't got the names here. I'm just gonna find my email.
Whilst you pull up the names, I think we're a close community here, and Emma is amazing at doing so many different things within this group. And I just want to, I thought you'd want us to share with you the fact that she's recently been promoted to principal researcher at the Alan Turing Institute.
Embarrass me.
Which is, a big name and a role, but she is totally fitted for it. And we're so excited for you, Emma, and about everything you're going to do in that role.
You very much embarrassed me, so thank you very much.
Well, you still look very cool, calm and collected.
I am not. Okay, so carrying on from that embarrassment. So we've got three fantastic speakers. And if you want to do a 3-minute introduction in any of our meetings, please do send us an email, because we are really open to having anyone introduce themselves. So I think the best thing to do, I will call out the names. So the first one is Erica Yang. Are you here?
Hello.
Brilliant. Hi, Erica. I'm
Hello.
sorry you're first. I didn't say any order, so
Right.
please, you've got about 3 minutes. I haven't got anything to time you, so we'll just shout. Yeah, go for it.
Yes. Hello. Hi, everyone. I'm Erica Yang. I'm from a company called Chiltern Computing based in Oxfordshire. Actually, we spend a lot of time and effort in healthcare, particularly in what we call enhancing or revolutionize everyday healthcare. Now, particularly as a lot of people in this group will know very well about the health aspect of research and all that. But what we always felt that care is an important element, particularly in terms of the long-term condition or chronic condition, and that everyday care is really important. And that understanding of how to care for those people living with long-term condition is not well understood, and there are, in terms of expertise and in terms of specialists, experts in the community particularly, is also quite limited range. Actually, there's a huge challenge involved in looking after those people. We work just to make a note. We work a lot with care home at the beginning, sort of as of now. The idea is moving onwards. We will opening up to more work with more people in the community and all that. As a company, stepping back a little bit, as a company, we basically do 3 things as this 3 minutes intro. So we develop better tools to help people to get better and the right type of data. And actually, AI is one of the key techniques that increasingly being used to drive that initiative. But one of the biggest challenge we see is, although we see a lot of large language model and all that, one of the biggest challenge for that is to make it scalable, affordable, as well as simpler to use. Second thing we do is develop better systems. This is again another big gap we see in the system, in the healthcare system, in the sense that a lot of good stuff happening and taking place, but in order to really make that system change or change at scale, you really need to join up those. Third is delivering the insight to the right people, be it clinical decision making or care needs assessment and all that. We look at a lot in the care home space, particularly chronic condition, long-term condition, dementia care, and those are some numbers on the slide. In case the challenge faced by the sector, particularly a lot of those people are developing symptoms or conditions over time, and a lot of this is because it's slowly developed and often unnoticeable. And there is a big challenge facing the healthcare, the care, particular social care forces in the sector, as you can see. So this is very challenging, and 70% of the care home residents are estimated to have dementia. So the first product we are developing in this space is what we call Caring OS app. And this app basically aims to address two important elements, which is currently not being well delivered in the sector. One is how do you deliver the everyday care observation, picking up the subtle signs and slow developments. And second is that implementation. How could you ensure that is actually sort of reflecting in the day-to-day change is actually effective, if you like, and we are actually working on that and expanding into a range of different sensors and sensing capabilities to complement that, in order to provide that change to the sector. Now, this is my contact information. Not much time to expand that. This is part of the Innovate UK funded project. We're very active in that space. Look forward to talk to everybody if there is opportunity to collaborate and all that. Thank you.
Thanks so much, Erica. That was really well done in a short space of time. And please do, if you want to put your contact details in the chat or on the Canva board, please do that. and people can contact you. Thank you so much. And if you do have a question for Erica, we do have to move on, but just put it in the chat and then she'll
Yeah.
answer that. Thank you so much, Erica. There we go. So we're going to Alpida.
Hi everyone, and thanks for having me today. I've not prepared any slides as I've not yet published anything in the field of AI, so I'm just going to talk about my background and what I'm going to do with this grant I got recently, which is on AI specifically. So my name is Alpida Venzilaki. I'm a postdoctoral epidemiologist and I work at the Leicester Real World Evidence Unit at the Diabetes Research Centre, University of Leicester. I was previously a PhD there and I continue to work with the team. So what we do a lot with our research group is we work a lot with data from CPRD, the Clinical Practice Research Data Link, hospital episode statistics, so a lot of like primary and secondary care data sets, and we analyze them to look at primarily cardiometabolic complications. My specialty is women's health particularly. So during my PhD, I did some research looking at gestational diabetes and the impact on maternal health in the long term. So I looked to quantify the risk of developing type 2 diabetes and other health complications such as hypertension, depression, and also I look to see what are the screening rates for type 2 diabetes. So if we can prevent it through improving screening, if we can introduce some interventions to improve health outcomes for these women. And that was the focus of my PhD. So starting from there, I became very interested in cardiometabolic health in women and having the knowledge in standard statistical methodology. Being an epidemiologist, I realized that where I want to go in the future is to extend my knowledge and develop knowledge in the field of AI and machine learning. So I applied for and I received an NIHR Development Skills Enhancement Award, which gives you funded time to actually develop skills in an area. And the identified area that I chose was machine learning and AI in health data science. So over the next 2 years, alongside my current job contract, I'm also 50% on this grant, doing training and doing courses, developing collaborations with other institutions. I'm currently also a visiting researcher at UCL, at the Institute for Health Informatics, where I'm working with the team to develop some publications. And alongside doing the courses and learning the methods, I'm also looking to publish in the field. So I'm looking to extend my network, meet other researchers, either in the field of women's health specifically and cardiometabolic health, or more broadly about either diabetes or heart disease research using machine learning and AI methods in health data science. So my aim reaching out to this group was to meet other people, see what work they're doing, see what Turing Institute does specifically through these groups. I'm also aware of the Women's Health Group. I'm hoping that I can join one of their meetings in the future. So hopefully this will be an opportunity to meet people and develop my network, and hopefully attend some meetings in person as well, as there's opportunity through my funding to do that and develop my network and potentially develop some collaborations. As in the long term, I'm looking to apply for an NIHR Advanced Fellowship. So I'm at this stage right now where I'm trying to finalize my research questions and think around which people I want to collaborate with. So I'll leave my information in the chat if anyone wants to get in touch, and hopefully I'll get the opportunity to talk to more of you in the future. Yeah, thank you.
Thanks so much. Very exciting. And yeah, please do. We've got a AI for Women's Health meeting. I think it's on the 22nd of this month, but it really sounds like we need to invite you as a speaker. So we'll definitely be in touch, because we'd love you to come and speak about your research. Brilliant. Thank you so much. And please do put any questions in the chat that you have for Alpida. And then swiftly moving on to our third intro, which is Dilshan.
Hi, everyone. I don't know if you can hear me okay. Hi.
Yeah, I can.
So my name's Dr. Dilshan Arawal. As you can see, I'm a clinical doctor. I'm actually on the ITU today. I'm a consultant in anaesthetics and intensive care. I'm also one of our chief clinical information officers, so do a lot of the digital transformations within the organisation, and also a clinical safety officer. I'm also, with my other hat, the CEO and founder of a startup called Shift Partner. And this is an NHS England funded startup looking specifically at workforce and how we can use AI to improve productivity. So just as a bit of background, the NHS budget, as you all probably know, is 200 billion, which is 20% of all tax revenues. And of that, we spend just over 100 billion on workforce. And despite that going up 5% year on year for the last 5 years, our productivity has been dropping. And our leavers rate is up at about 10% now nationally. The NHS long-term workforce plan that came out last year identified a need to reform the workforce with novel roles, to upskill the workforce so they're all working to the license, and to retain the workforce. And yet, despite those quite grand aims, it's quite surprising that we know very, very little about our workforce. We just know what their titles are and maybe what their address was about 10 years ago. So what we are doing at Shift Partner, and we've been supported by NHS England's Clinical Entrepreneur Programme. We've also been supported by UCL CDI Accelerator Programme, is to actually use artificial intelligence to better describe the work and workforce in terms of skills and capabilities, but also understand the workforce's preferences so we can better deploy. And so what we have built to date is we've been taking a corpus information using natural language processing and bespoking a large language model to build a skills ontology around the practical skills, and we've deployed the first version of that around one specific use case, which is around operating department practitioners. We've just recently upgraded it to include nurses and associates. And using these skills and capabilities, we can describe the workforce in far better detail. We also, from my own research, use thematic questions to understand where people are on their personal professional journeys in terms of what their preferences are. What are the motivators and blockers that prevent them from upskilling and from staying in the NHS? We've run some pilots last year, and the data kind of proves the research that there are skill variations, the needs vary across the week, and people's preferences are quite different and dependent on micro and macro factors. In terms of the where we're at, so we've got a team. We've actually got one of the Turing PhD fellows as part of our team, also a professor from the UCL IHI, as well as multiple clinical and operational people. We've just been onboarded by Health Innovation Network of the East of England, and we were shortlisted for the NIA, so I had an interview last week for the National Accelerator Programme. We'll find out about that. So we believe we've got something really quite unique, and that's something that's very scalable and hopefully add a lot of benefit to the NHS and build a workforce for the future. And I guess what am I looking from this? Well, one is there's loads of fantastic sounding projects, and my own general learning I think would be amazing from this group. So to meet like-minded people, maybe some support for what we're doing, especially around some of the behavioural elements, and also the ability, I guess, to support other people. I mean, in my position as a CCIO and clinical safety officer, have a lot of networks within healthcare organisations, so it can help with putting in touch with people on the ground to develop ideas. So thank you very much for your time.
Amazing. So that is fascinating to me because it's really up my street, the work that you're doing. Are you connected at all with the NHS England competency group? It's part of the data science team in NHS England.
No, I'm not actually, no.
Yeah, I think I can see a real connection because they are building competency frameworks. So obviously the skills and knowledge behaviour, the competencies, but specifically starting with data science roles within the NHS. And so it sounds like your two pieces of work could kind of come together in some way. It sounds like there should be a real connection. So I'll definitely follow up with you to see if I can kind of make that connection for you, because we work with them on several projects because we focus on competency frameworks as well in our skills team at Turing. So really fascinating. Thank you so much for sharing. And thanks to all the speakers. It's really great to see the variety of people that we have in our membership. So I am going to swiftly pass on to Joe so we can actually have more connection and do a bit of networking today.
Thanks, Emma, and thanks to our three lightning speakers. Really fascinating as always. My screen is currently filled with Dilshan pins. I'm just going to unpin you so I can see everyone else. There we go, fantastic. So I think now we're going to move out to the Canva board, aren't we? So hopefully everyone has that. Maybe we can drop a link to it again in the chat just for those that have joined us a bit later. And so if you open up your Canva board, what you're going to find is some pre-populated spaces where we can talk about, well, basically the plan for the next kind of, let's say 20 minutes or so is to break up into small groups of 3 or 4 people. And we're going to talk through the areas of the Canva board. So what we're going to ask you to do in your small groups is to introduce yourself to each other. We're not going to look for this to be very, very structured, so feel free to be a bit creative with what you talk about. But we'd love you to speak about what you're looking forward to do in clinical AI this year. And then if you could have a think about some of those things on the Canva board, so what we can do to help you basically. So just for instance, I can see that there's an area for events, an area for new resources, an area for ideas and collaborations, talks and speakers, training resources and funding. So if as part of your discussion you come up with some great ideas that you think might be good to share with the group, feel free to drop them down on the Canva board or to drop them in the chat. And then we're going to come together as a big group at the end and share our ideas again. So hopefully everyone's managed to open up the Canva by now. If anyone is struggling at all, just let us know. And I think we're going to break up into some small groups, aren't we? Hopefully that was a useful discussion for everyone. Thank you all for contributing. So because we had so many breakout rooms, we're not going to come to you one by one because that would take forever. But if anyone has any particular pearls of wisdom from their group discussion that they'd love to chuck into the mix, please do feel free to start talking. We've got a few minutes. I will start off just because I know you might be thinking still. So one of the kind of key things I think we talked about was whether there's an opportunity for this group to host a national meeting, perhaps to bring together experts from across the sector to use the Turing's kind of convening power to run some sort of conference. I know there's obviously AI UK and other similar conferences, but maybe a symposium on a particular topic or a themed meeting for a particular area of health tech. So that's the consideration when you think about it. Any thoughts from any other groups at all?
Maybe while others are thinking, Joe, I'll jump in with a couple for mine. Just pop your hand up or just shout if you have. But one of the themes that came through ours, and actually it is with us, is the piece again on the clinical AI skills and how to help to navigate some of that. So that what is an AI, Sophie made a good point about an AI upskilling strategy for like an NHS trust or a pharmacist or, you know, all those other things. But also Jordan has some great examples of learning of kind of, in the phrase you used, Jordan, was micro teaching, where you're teaching a real applied example. So this would be AI hallucination in practice in radiology, and how that worked and how that kind of helped clinicians to see what the benefits and the limitations are of those types of tools. So I think we, some of you in the group may have joined us previously or contributed at the end of last year. We had a piece on the clinical AI skills and upskilling, and a discussion with Health Education England and other partners as well too in Scotland and Wales as well too joined in. So I think we can build on that. So that's one for us definitely to pick up, I think.
Great, thanks, Alicia. I see some hands coming up, but also some discussions in the chat. So let me go through the chat first. So there's been a mention of whether or not we can have a primary care super interest group, which is a nice idea. Zoha mentioned the idea of an unconference meeting. For those that haven't heard of an unconference, they're really fun. It's the idea, basically the idea is you turn up, you bring a group of experts together, and you deliberately don't have an agenda or a structure. So you allow people to be very creative about how they want their discussion to run. So they might choose to pitch a half-hour walk around the garden, or to do a whiteboard session, or to, I don't know, have some sort of coffee chat. But the point is, you're not telling people what to discuss or how to discuss it. You're giving them freedom to do that as they wish. That could be a nice idea. I can see Dilshan, you have your hand up. Do you want to unmute and have a look?
Yeah, hi, thanks, Joe. So we discussed around some of the issues around AI in the clinical setting, around how suppliers promise us the earth with all their solutions. It's being sprinkled around like fairy dust, and what we don't see much of is the transparency in how the AI solution has been built, how it's been evaluated. And also what impact it's having in terms of whether it's creating any biases. And from an organizational perspective, we don't have the capabilities to actually evaluate these elements. And this may be something where there's something that's mutually beneficial, where tying maybe with PhD students or postgraduate tutoring with organizations like my own, or how can we evaluate whether it be a big EHR in terms of how efficient and productive it is, or even the AI solutions within it, are they doing what they think they're doing? Because at the moment, where the risk lies with the organization, and specifically it lies with the clinician. On the front line, and so how can we use AI to better evaluate and these tools that are coming at us, and fast and furiously.
Yeah, great contribution. Alicia, do you want to come back in on that one?
Yeah, I just want to ask Dilshan, that's a fantastic, I'm a head of evaluation in Public Health Wales here, and that's a fantastic question. I'd love us actually to do something in that space, to help in that space, even if it's convenient to think about a way forward. I just wanted to ask, whenever the tools that you're talking about, are you talking about tools that have gone through the regulation process within the MHRA, so the ones that are deployed and actually in practice, what do they generate? Or are you talking about tools like the one you've developed, which sounds brilliant, or the large language modelling about skills and kind of, so those non-clinical tools, or is it both?
Yeah, so I think it's both. I think the immediate need from an organisational perspective are those that are clinically facing, and those that come under the term clinical decision support tools, because those are the ones that I think are having a direct impact right now, and a few that have crept in pre-regulation, which I think haven't been fully understood, which are still live products. And there is a degree of risk that needs to be taken for sure. We're all learning. We want to get the best out of these things, but I question: are we learning as we're deploying and scaling these products?
And are we sharing that learning as well? So,
exactly.
Lovely.
Yeah.
Thank you. Sorry, Joe, go on ahead.
No problem. So I can see a few comments in the chat as well, which I'll try and do justice to. So again, another +1 for the idea of in-person meetings, but also a suggestion of maybe enabling mentorship in some ways, whether that's allowing people to do that themselves, but at least sharing kind of contact information, or whether we have a formalised mentorship offer as part of the group. That's a really nice idea, one that I've not thought of before. There's a request to plug the NHR PENARCS, or Digital Academy Health Service Modelling Associates Programme, so consider that one plugged, and hopefully people can do some Googling there as well. And then a mention that the Royal College of Radiologists has started producing and delivering AI training packages. And also, I guess, just to mention about the RCR Global AI Conference, which is happening in just a couple of weeks. And Jonathan Nash has popped a link in the chat to that one. Great. And then some other people sharing contact information and asking for collaboration. So we're coming up towards time. I wonder if anyone had any final contributions from their breakout rooms, and if not, we can bring things to a close and tell you a bit more about our next meetings. So any final contributions or comments from anyone?
Can you hear me?
Yeah, we can. Yeah, go ahead.
Yeah, in my room we were talking about, I'm Bash Bash, I'm a radiology consultant and clinical mathematics for AI for BHIT North East London. One of the things that we discussed, particularly from the DHH, is how to set up projects and how to coordinate with your own, particularly if you're not working at areas of university, it's difficult because everyone's clinical, and how the importance of how to work fundamentally with your ops team and find out what the actual goals are, to be quite focused on it, because that's something I think that can be quite difficult, that setting up a project, because particularly in a DGH and winter comes, the corridors are full of patients, everyone's a nightmare. So I think that'd be something that'd be quite useful advice on how people got to set up a project, how they got the funding for it, and how that's done, because I do think sometimes we have to be very careful when we discuss these projects. We don't, go from an overly too centralized tertiary perspective, because some of the advice for that area won't really work in clinical projects anywhere else, because that degree of support isn't particularly there. That's something we did talk about.
Great. Thank you so much. That's a really important contribution there. Alicia, over to you to close off.
Lovely, thanks, Joe. Thank you so much, everybody. It's just brilliant. This always turns out to be the highlight of my week or my month. So I've come away with loads of ideas. Our next meeting, just quickly, is on February the 11th. Usual time slots. It's on a Tuesday. We haven't got a speaker for this one at the moment, but actually, I'm wondering if we can build on some of these themes to do that. So we will be sending out details on who, but the date and the time will be fixed. Just to say a huge thank you. I think the cabinet board will stay open, will it, Emma? For a bit, yeah. So if later on today or tomorrow you have other thoughts, then drop them in. You can also contact us. You've got our email addresses as well too. But yes, it's just been a really lovely fun meeting today. I don't think there's anything else. Is there, Joe, Nick, Emma?
No, just we've got other meetings of super interest groups. So the MSK first inaugural webinar is. Oh, and I see the puppy. Oh my goodness, Nick's puppy, gorgeous. Is on.
I just introduced the latest member of the clinical AI family. Meet Bracken, everyone.
Lovely. So MSK is tomorrow at 12 o'clock. AI for Women's Health is next week, the 22nd. January at 12 p.m. And yeah, I think there are links to those on our website. So thanks very much.
Lovely. Fantastic. Thanks, everyone. Have a lovely afternoon.
Bye. Bye.
Thank you. Bye-bye.
Thank you.
Thanks, everyone.